Hello, I'm Daniel Regan and I am the Executive Director of the Arts and Health Hub, which is a network for artists that are interested in or are working in the arts and health sector. And we provide professional development opportunities as well as mental health support, clinical supervision and mentoring opportunities for early career artists. The hub was started by myself as an artist who makes work around mental health, particularly as an artist with lived experience. And so at our first event, there were just 4 of us getting together to share our works and challenges and ideas in a way that was supportive and very different to our experiences of the traditional art world. And since that first meeting in 2015, we've delivered over 90 peer groups now and a number of projects that look at both professional and mental health support for artists in the network. In the beginning stages of the Arts and Health Hub, I was covering lots of the costs myself, so covering the cost of refreshments, but also the digital costs of running the website and paying for the mailing list. And as the network began to grow, that was becoming unsustainable for me as one person. And so I was looking at how to develop the organisation and looking at different structures and models that we might be able to use. So the 2 that I was looking at were whether we would register the Arts and Health Hub as a registered charity or as a community interest company. And ultimately, I decided to go with a community interest company that has a board of directors. So there's myself and 2 other directors, both who have their own valuable experiences that they can bring in terms of the governance of the organisation and the long-term strategy and direction that the hub is taking. The best advice that I got and the best support was from people who had already done what I was looking to do. So I tried to talk to as many different people who had started their own community interest companies or charities and get the pros and cons of their own experiences. For me, I was able to ask people questions about what worked, how it worked, what worked well and what was difficult, and also think about the right structure for our organisation. So the way that a community interest company operates is that it's a registered business, but you can only conduct business to the benefit of your specific group that you're serving, your community. And so for us, that goes back to our original intentions of supporting those artists that are either working in or interested in the arts and health sector. And it's really helped to put together our articles of association, our objectives of what the organisation does to make sure that we stay on track and that we're working with the community that we originally set out to work with. By registering the Arts and Health Hub as its own business, its own entity, it means that we now have access to a wider pool of funding that wouldn't be available to us before. Previously, it was just myself applying for grants as an individual, and although I was successful in receiving 2 grants from Arts Council England, registering as a non-profit organisation means that we have doors open to us that are not open to individuals. And it means that with a board of directors and paid staff, such as myself and a project manager, we can now put the work in that's needed in a way where we're being compensated and no longer simply volunteers for an organisation, but are able to incorporate this into our working days, which means we have more time to apply for bigger funds so that our network, which has expanded, also have more opportunities. And it's meant that there's been partnership opportunities with interesting places like the Royal College of Psychiatrists and NHS England to commission artists to deliver creative wellbeing workshops for a number of healthcare staff. Becoming a CIC has felt like a logical step for the Arts and Health Hub, now that it's its own professional body. But of course that does come with challenges, because we have additional costs now that we need to pay for. We need to pay for an accountant to file our accounts. We also need to pay for insurance to make sure that if something were to happen, that we're covered and guaranteed. And in order to pay those bills, we need to generate income. So not only are we looking at grants that we can apply for to deliver particular projects, we also need to look at revenue generating events that can help cover some of those administrative costs. But at least doing it this way, we're working as a team who are looking to cover the costs of the organisation. Whereas before, in the beginning stages, it was just myself having to cover all of those costs out of my own money. So it feels like a far more professional service that we're providing. It's its own business now, and there are protocol that we need to follow in order to finance those administrative needs. Taking your user-led group to the next level can feel scary, and I remember that myself when I was initially first thinking about registering as a charity or a CIC. But I guess for me, what I realised was that it wasn't sustainable to run the network like this, particularly as I wanted it to grow and have further reach. But I'd really encourage you to do a bit of research about which structure might work best for you. Do you even need to register as an organisation? If it's about money, then maybe look at potential funders' guidelines and criterias, and maybe the way that you're operating now is perfectly acceptable to them. It really depends on who you want to approach for funding. And I'd really, really encourage you to speak to other community groups that have gone through this process of registering themselves as an organisation or as a charity to get some feedback on the pros and cons and what works and what doesn't.